welcome to the presentation area. Judith Maka, this is your platform, and you are going to presenting the factors influencing the HIV positive of exposed children in two health facilities in Yaounde, Cameroon.
Thank you very much for this opportunity you give me to share this work, factor influencing the HIV positivity of exposed children in two health facilities in Yaounde. I will continue by saying thanks to the Texila for this opportunity that they give to us to share this work far from the sub-Saharan Africa, who face in every developing country the HIV challenge, with the prevalence of 4.3% of HIV in the population in 2013. But today we have a slight reduction with the less CAMFIA study. But among the pregnant women, we still have 7.6% the prevalence, with 90% of children infection, which is due to the mother-to-child transmission. But during 1 year, for example, from April 2017 to May 2018, we try to follow 113 couple infected mother and babies in order to improve the quality of services. So data was recorded in Excel instead of a PMFO, but analyzed with statistic package of social sciences. But to continue, we would like to summarize and say that we try to obtain a good early infant diagnosis compared to what was expected, but 6.3 prevalence of positive children, many of them in a low socioeconomic situation. Due to the fact that the PCR analysis was done out of the point of care, we obtained an association between this point of care and the status of children. So we came to the conclusion that this early infant is accepted and better strategies need to be done. But how far is the Cameroon with this problem? We have, since 2010, an international and national guidelines for PMTCT, well known, but the Cameroon, since more than 5 years, tried to put a free screening test, free lab test, free antiretroviral treatment and opportunity diseases to pregnant HIV positive women and their children. And the Ministry of Health is trying today to expand this early infant diagnosis in all the health facilities. But even when they are trying with what the United Nations targets to end the AIDS, we still have a gap between the number of HIV positive children registered and the number on effective heart. And even with the gaps between the number of children registered in the delivery room and the number of children registered for the PCR analysis. So we trying to compare with what was already done in the literature, child mortality, which is still high in developing countries. The strategies like option E, option B, and option B+, which are interventions which helps the whole world to the coverage of antiretroviral treatment and to help people to reduce this prevalence. We still know that risk factors vary depending on the region and depending on also from setting to setting. A previous analysis of our study who compare the implementation of option B+ since 2010 to 2015 show also a gap between all those steps of the PMTCT, which enables us to conduct this study, which was a mixed method study with quantitative and qualitative approach, using the questionnaire and the longitudinal design for the quantitative one, and an in-depth interview addressed to HIV positive mothers and their caregivers to assess the quality with respect to our ethical consideration. So as I was saying, during 12 months, we interviewed all those participants of our study, mothers who accept to be recruited, and we recorded all those information in an Excel, and we analyzed this in the SPSS to answer our research questions. As a descriptive analysis, we perform monovariate and bivariate analysis to obtain a good response of 98%. This curve shows us how we selected and we recruited our participants. The blue one is for the BMRC District Hospital, because we conducted our study in two sites, two health facilities, BMRC District Hospital and Efulan District Hospital. This has a large implication on the response about the fathers, because we do not have enough information about the fathers. And since the PCR analysis was performed out of the point of care, we have the turnaround time for about 45 days compared to 1 day when the PCR analysis is performed out of in the point of care. 113 children recruited, 7 over 111 were positive, and we also obtained with an in-depth interview, a summarized situation of exposed lack of caregivers' motivation, overwork pressure, and the poverty, because HIV positive mothers could not afford to come for the rendezvous for 6 weeks PCR analysis. But we tried to obtain this PCR analysis even for more than 6 weeks, 9 PCR1 or PCR2, not on the time like as the calendar of the WHO recommended. So we came to the conclusion that early infant diagnosis is well accepted, well responded, and that the lack of services commodities, the lack of funds, the lack of financial resources, and some bad organization services, because there were few caregivers that was changing services to services. This seriously affects the HIV status of exposed children. And as a future steps, we think that a good sensitization of caregivers, HIV positive mothers, should help, particularly the caregivers, with the implication of gynecologists and pediatricians, because during our whole study, it was always nurses who were in front of the mothers to collect information. Communication fees and transport fees for HIV positive mothers and their caregivers was really a good problem, because there were no funds for the communication, no funds for transport fees. And in some sites like Efulan Hospital, the home visits were really prohibited due to the fact that due to some sociocultural reason. Further studies on large sample size positive children or adolescents will help us to control and to observe the antiretroviral treatment adherence and side effects that could happen far away. And we are always continue even to recruit our patients in order to give further results which can help the community, research community, to give some orientation to our Ministry of Health and the world to catch this challenge of HIV. So here are some references that we give to help you people to understand and to see that what we saw in Cameroon was not the worst one, because in our study, we even found the more prevalence of HIV among children to, for example, in Ethiopia, but that was in larger sample size, and they did not at that time have a good implementation of option B plus. So we really thanks you for your kind attention, and thank you very much.
Dear participants, please poll for the presentation done by Ms. Judith Maka on the title Factors Influencing the HIV Positivity of Exposed Children in 2 health facilities in Yaounde, Cameroon. Please poll for her. So here we close the polling session.